to patient like they are a child. I paid 13,000 to this place to end up getting treated like I am less than Dr. Anil Shah. I think it's time to reevaluate your employees before they ruin your establishment. Okay. See, okay, that's recent too. December 2023. Social media surgeon. I agree with this. He's on like Instagram and everywhere, just trying to get views, but no quality work. Business model is cheap prices, not respected. Exactly. So as I told before in one of my, I think, posts or vlogs, I don't know if I made the video on that or not, but he's like a Walmart of plastic surgery, like cheap prices. People get attracted, they go, but they get like disastrous work. So, there's no point going to Dr. Anil Shah. It's not like Walmart where you get quality stuff for cheap prices. No. That's 5 stars. Great stuff. They made the process so comfortable. Okay. That's April 14, 2021. Okay, that's Dr. Anil Shah's wife. I live in Los Angeles now, but still fly to Chicago to get injections with Dr. Samia Chugatai or Dr. Anil Shah. They both have an eye for aesthetics and I trust them completely. The office is in great location and the staff is super nice. I can wait, go back for more. Thank you being such an amazing practice overall. Make me feel, wow. Okay. So that's for the injections for fillers. Oh, she still lives in Los Angeles. Okay. Okay, so this one is December 30, 2021. And this is 1-star review as well from Indianapolis, Indiana. This is a review of Dr. Anil Shah, MD. This review is basically solely on my opinion and experience in dealing with Dr. Anil Shah and his office. Several years back, I was at work and co-worker commented that I was getting horns after saying that I looked at myself and noticed my forehead was not smooth. I found a cleverly marketed video on YouTube of Dr. Anil Shah doing a forehead procedure on a patient to make the forehead nice and smooth. With Anil Shah being close, I decided to schedule a consultation. Before my appointment, Dr. Anil Shah scheduled a CT scan to see exactly what my forehead problem was. I had consultation and Dr. Anil Shah confidently discussed how he would remedy the problem. Talked as if the procedure was old hat, like easy, Old hat means like easy, like not a big deal. Same thing he like did it with me, like we can do it, like don't worry, it's easy and all that. But that's his acting skills. He doesn't know too much about surgery. Okay. I really liked that this was an in-office procedure and to avoid the trouble and expense of anesthesia, I paid my deposit and had my procedure. Same with me, I also paid my deposit as well. My forehead was not made any better, nor did it look really any worse. If I recall correctly, I scheduled an in-person follow-up with Dr. Anil Shah in his office. At that point, he injected my forehead in one spot with a steroid, which helped temporarily. Well over a year later, my forehead still bothers me. So I reached out to Dr. Anil Shah. He said he wanted to do a touch-up and I agreed. Okay, let's go to bottom because this is a very, very long review. Approximately another 12 to 18 months went by and my forehead problems persisted. I reached out to Dr. Anil Shah yet again. We had a Skype conference call. He was running around the office. See, once he gets the money, he runs around the office. He doesn't pay attention. Money, now giving attention to more like to the upcoming patients because they are the one who will give you money. So it's money, 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 money. Okay, he was running around the office talking to his employees all the while. I'm trying to express my concerns. This time around, Anil Shah suggested going with an endoscope and making the forehead symmetrical. I was keen to this approach because the previous 2 approaches were not getting results. I scheduled my 3rd procedure with Dr. Anil Shah. By the way, anytime he does this in-office procedure, he basically gives you a lot of drugs like a painkiller, Valium, and some other stuff to sedate you. Well, on the 3rd procedure, Anil Shah gives me the drug upon the arrival and sends me back to the waiting room while they kick in. Well, after 45 minutes or so, I'm taken back for the procedure. Anil Shah nurse is talking my ear off. What does this mean? And it's a good time. Right before Anil Shah comes into the procedure, the nurse tells me Anil Shah isn't going to do the endoscope, but instead is going to file the bone yet again for 3rd time. See, what a fraud artist. See, oh, that's what I'm telling. That's what he did with me. People are having same experiences. He did with this guy. Dr. Anil Shah did with this guy as well. He told him that he was going to do a bone-in procedure, promised him that on Skype, called him in, sedated him, gave him the painkiller medication, and now after when he's ready, they are telling him that they are just going to do the same thing what they did twice before, and the patient was not happy from the previous two procedures. Wow. So they are not going to do the endoscopic surgery. They are again going to do a bone in. So wow, see, Dr. Anil Shah thinks that you are a stupid asshole and born yesterday, and he can just play with you just like that. I'm not stupid person, so I'm reading it back again. I'm not stupid person, but not sure what Anil Shah was thinking. If I wasn't drugged up, I would have likely walked out. Performing a filing procedure on a patient who only consented to an endoscoping procedure is medical battery. I filed a complaint with Illinois Department of Professional Regulation. Now, Illinois Department